आज हमारे साथ गीताली साइकिया है जो कि एक रजिस्टर्ड रिहैबिलिटेशन प्रोफेशनल विद आरसीआई एंड शी हैज बीन डेडिकेटेड टू दिस फील्ड सिंस 2002। उन्होंने उनकी जर्नी स्टार्ट की दिल्ली से एज अ डेवलपमेंटल थेरेपिस्ट and her early work with children with severe physical disabilities ignited a deep passion to empower parents and provide comprehensive support. She has been continuously working since 22 years to enhance her skills to deliver the holistic therapy to children, adults, and senior citizens alike. गीताली का एक इंटरवेंशन सेंटर है जिसका नाम है मैजिक ऑफ इंटरवेंशन। वो गुवाहाटी में असम में बेस्ड है और उनकी टीम और वो प्रोवाइड करते हैं ऑनलाइन एज वेल एज ऑफलाइन थेरेपी सेशंस so that all needs of special needs are met through a holistic approach. और उनकी जो टीचर ट्रेनिंग प्रोग्राम्स है वो भी डिजाइंड है टू फोस्टर इंक्लूजन इन एजुकेशनल सेटिंग्स। गीताली is an oral placement therapist, handwriting without tears therapist, sensory integration, reflex integration और brain gym program, all the therapies and many more that she uses in her program. So welcome Gitali. Thank you so much for accepting my invitation to come to my channel.
Thank you, Minas. Thanks a ton for having me here, and gratitude to all the parents also, so that we could help them, empower them in our journey, so that they know there are certain tricks which is surely going to help them in the development of the child. Thank you. Thanks a ton, Minas.
I'm sure it's going to help. तो आज का हमारा टॉपिक है पिकी ईटिंग। So Gitali, what is picky eating?
So picky eating अगर हम बोले तो अगर हम उसको सोचे पिकी और ईटिंग तो खाने के बारे में है। तो अगर खाने की चैलेंजेस है हमारे बच्चों में तो 10 से कम और कोई कोई बोलते हैं कि 20 से कम, only they eat those many things. So they are called as picky eaters.
Okay.
And now there is a scientific term to it which says pediatric feeding disorder.
Okay, I see. Okay.
So a picky eater can be a severe picky eater where they eat only less than 10 foods, or they may even be an average picky eater जिसकी food habits 25-30 से ज़्यादा है। पर जहाँ हम सीवियर पिकी ईटिंग की बात करते हैं वहाँ बच्चे कुछ बच्चे तो केवल 3 या 4 चीजें ही खाते हैं और बाकी चीजें देखते ही या तो गैग रिफ्लेक्स शुरू हो जाता है या दे विल थ्रो अप, उल्टी कर देते हैं या मेल्ट डाउन भी हो जाता है। सो दैट इज सीवियर पिकी ईटिंग।
When do parents consult a doctor? Is there a particular age या symptoms that they have to see that they have to consult the doctor?
हमें जैसे ही दिखता है कि बच्चे को मुश्किल आ रही है, आई एम टॉकिंग इवन इन्फेंट्स, इवन न्यूबॉर्न बेबीज, जहाँ अगर ब्रेस्ट फीडिंग में मुश्किल आ रही है, दे आर चोकिंग, गैग रिफ्लेक्स बार बार एलिसिट हो रहा है, हमें बिल्कुल मदद लेनी चाहिए। एंड टॉकिंग अबाउट our medical fraternity also, it's a sincere request that when we see our children having difficulties in feeding, we will not wait and watch, but we will start as soon as possible. We'll consult a pediatrician, we'll consult a gastroenterologist if needed, and yes, we have to change a lot of habits which we have in our household. So it's as soon as possible.
So what are the underlying reasons for this picky eating?
So when we talk about picky eating, so first and foremost is their sensory profile. If they may be hypersensitive to touch, to smell, right, to taste, or they may even be hypersensitive to it. So that is one when we talk about sensory processing, बहुत ज़रूरी है. एंड हम लोग ना हमेशा 5 सेंसेस की बात करते हैं, पर उसके सिवा भी हमारे 3 और सेंस है। इंटरोसेप्शन, सच में पता है या नहीं भूख लगी है, या खाते जा रहे हैं पता है या नहीं कि पेट भरा है। देन प्रोप्रायोसेप्शन, बहुत बच्चे हैं बहुत क्रंची फूड ही खाएंगे, या बिल्कुल सेमी सॉलिड ही चाहिए, गरम नहीं खाएंगे, ठंडा नहीं खाएंगे। कुछ बच्चे हमारे हैं जो बस दौड़ते फिरते हैं, दे विल नॉट सिट इन वन प्लेस एंड ईट, सो वी हैव टू कीप दोज थिंग्स इन माइंड। देन द सेम थिंग अबाउट when we talk about oral musculature, so lips की strength, jaw की strength, tongue, cheeks, उनकी strength, उनकी coordination, and they all should work in dissociation, साथ साथ नहीं। Coming on to certain physical things which we need to keep in mind are, अगर tummy upset है, constipation है, if they are lactose intolerant or gluten intolerant, we have to keep that in mind. And the most important thing is snowballing effect. क्या है? बच्चा नहीं खाता है और हम नहीं देते हैं, वो धीरे धीरे ना खाने वाला जो उसका लिस्ट है वो बढ़ता ही जाता है। सो दैट इज कॉल्ड अ स्नोबॉलिंग इफेक्ट। मैं थोड़ा सा इसमें बोलना चाहूंगी कि बच्चे जब छोटे होते हैं, जब 1 से 3 साल के बीच हम लेते हैं, तब अगर हम एरिक्सन्स की डेवलपमेंटल थ्योरी के बारे में भी पढ़े तो वहाँ पर हम पढ़ते हैं ऑटोनॉमी वर्सेस शेम एंड गिल्ट। उस वक्त उनका होता है कि हाँ मेरा इंडिपेंडेंट है सोच, तो वो सबसे पहले कोशिश करते हैं खाने में कि हम ये नहीं खाएंगे, ये वाला खाएंगे पर ये नहीं खाएंगे। शायद चिप्स खाना पसंद है, चिप्स ही खाती रहूंगी, चोकोपाई खाना चोकोपाई खाते रहना है। बट those things they have to outgrow it within a year or 2. अगर वो 5 साल तक चल रहा है वो नहीं हो सकता है। We have to have an open eye कि हाँ कहीं कुछ बदलाव लाना है खाने में।
Thank you. That was very informative, Vitali.
Thank you.
I believe the incidence is rising now. So what is the reason?
So when we see ourselves today, we are just rushing around. It's very rare that we sit and eat together. That is one main reason. And children glued to their screens eating don't even know what they are eating most of the time. And especially post the pandemic, because they were home, they didn't have that social interaction, they were on the screen, and that's a major reason for picky eating at the moment. They're not aware what they're eating, they haven't got the experience कि क्या खाना है क्या नहीं खाना है। और जैसे मैंने बोला, हाँ एक चीज नहीं खाते हैं तो हम छोड़ देते हैं, अच्छा नहीं खा रहे हैं, पर हमें वहां पर वो एक्सपीरियंस दिलाना है उनको। एक दिन नहीं खाया कोई बात नहीं, 2 दिन नहीं खाया कोई बात नहीं, पर अगर हम वो देना ही बंद कर देंगे तो मुश्किलें आ जाती हैं। और अगर हम देखें हम लोग छोटी छोटी चीजें करते हैं, अगर सेमी सॉलिड खाते रहते हैं बच्चे आराम से खा लेते हैं तो हम सेमी सॉलिड बहुत दिनों तक खिलाते रहते, पर हाँ सॉलिड में जाना है हमें, वी नो दे हैव टू मूव ऑन टू सॉलिड्स। फिर हमें लगता है अच्छा मीठा खाते जा रहे हैं तो मीठा ही देते हैं क्योंकि आसान होता है। सो फ्रूट्स एंड वेजिटेबल्स की बात आई तो हम छुपा के देना शुरू करते हैं। शुरू में यस, टू इंक्रीज द कैलोरीज वी हैव टू ब्लेंड इट विद देयर फूड। Suppose even if it's a small puree, we will mash the vegetables and put it out there. But gradually it should be age appropriate. A child who is 3-year-old should not be having pureed food. The child should move on to solids, which comes very easily when we move according to the milestones. Then the second thing is that the child should be involved in the whole process of even preparing the food and eating it. जहां हमें मुश्किल दिख रही है, I just move back and forth थोड़ा सा, तो जहां हमें मुश्किल दिख रही है, अच्छा बच्चा नहीं खा रहा है, बस अगर हम सुबह बिल्कुल हल्का सा कुछ सेमी सॉलिड देते हैं खा लेते हैं, हमें क्रंची फूड देना ज़रूरी है, नहीं तो वो नहीं खाएंगे. सो fruits and vegetables नहीं खाएंगे. So how do we start off? We can just ask them to help us while we're preparing it. सब्जी निकालना, फ्रूट निकालना बैग से, धोना, उसके बाद हमने काट दिया, बस वो मे बी सर्व कर दे प्लेट में, हमें हल्का सा हमें खिला दे. So that is the first step. So keep increasing their experiences of smell, touch, taste. That is very, 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 very important. Then comes when we talk about, it's not only in children, it is actually, if you see, a lot of young adults, even teenagers, they haven't outgrown their picky eating habits. They stick to their specific brand, specific food. But yes, if you work with them, and cooking is the best way to introduce new food to the children. It's an excellent, excellent way.
Nice. Thank you so much. And can you suggest some techniques, simple techniques that parents can use?
So when we talk about all of these stages of feeding, we know the child is breastfed, moves on to semi-solid, moves on to solids. So whenever we are moving on to those stages and we are stuck, we need to think, how do we go about it? If we see a child who is still drinking milk from a feeding bottle, at the age of 3, at the age of 4, we know that the child might have certain issues with speech and language too. So what do? We have to remove the bottle. Can we move the child onto a sipper first? Then we move on to maybe something which is easier, a small glass or a cup. Then coming on to semi-solids to solids. What is that small thing that you can bring onto the plate? Just one bite would help. And we all know that when we talk about the eating habits, we all have to be relaxed while we are feeding our child. So if we are anxious, it filters onto our child. So what I always tell parents is, calm yourself down. So how do we calm ourselves? There are a lot of techniques. You can use your breathing techniques. You can just sit in one place, take a few deep breaths, have a sip of water, and then when you're calm, it's easy to work with the child. And we know that there are reflexes which needs to be integrated. So as soon as if the child is seeing the food, if the child screams, cry, we know that's a fight or a flight. So let's integrate the reflex which is actually bringing in that response. So that would be the Moro reflex. So we'll work on that. So for that, simple techniques, you can even use certain points which Minaz also is aware of. That's where I got to even learn, and even in our brain gym, which we just spoke about in the reflex integration, we have got our positive points. So first the parent or the caregiver, just hold your point. So we have one here, up here on our forehead. Hold it here, breathe. Your temples. Hold it here, breathe. You can even do it when the child is sleeping. Take an intention. Do it, it works. We have it between our eyebrows. I'm just showing 3 points. We can do that. Then coming on to best part. Involve the child in the preparation, in the cooking. Nothing better than that. And we do not introduce the food directly into the mouth. So let it be somewhere on the table. Always, it's easier when the child knows what is going to be served for lunch, for dinner, for breakfast. And we are talking about a bit older children who can understand. So instead of surprising them, it's like, okay, we will have maybe aloo paratha, or we'll have fried rice, or we'll have rice and dal, and along with it, whatever food they like. It's always there. So if you have a small meal plan, The way we write our tasks for ourselves, have a whiteboard or any a small thing pasted on the wall. Write whatever you're serving for lunch, for breakfast, for dinner. It's easier for the child. The child already knows what's happening. Eat together, the smell, the taste comes. The child might pick up a bit and eat. So start with that.
That's a simple thing that parents can definitely do it. Yeah, plan a menu and take their also what is it that they would like to eat and include that also in the menu, and they
And
know
when
which comes
we, yeah,
first.
and even when we introduce new food, involve the child. Simple. When you're making a sabzi or something, you're making a vegetable, tell the child, okay, if the child is fond of maybe fried aloo or fried potatoes, fine. We will add a vegetable to it today. Try it. If you don't like, you can even put a no thank you bowl on the table. So instead of them screaming, shouting, they can just pick up the thing which they don't like and put it there into the bowl. So what did you get? The child held it,
Mm.
right? So the touch is there. Instead of the tantrum, the child knows, okay, I can keep it away.
Yeah. So, from what I'm understanding is that it's not necessarily that a child with special needs or somebody who has speech issues will be a picky eater. Even a neurotypical child will also be a picky eater because he's not been exposed, or he or she's not exposed to different foods. Because in the first instance only that disliked, so parents have stopped giving them, right?
Yes. So what happens is once we see the child hasn't eaten that specific food, we stop providing that exposure. And
Mm.
that's where the list keeps on increasing. The child knows I throw a tantrum, I do not eat it, I don't get it. And one more very important thing is in between snacking.
Mm.
So, what a infant would need, the amount of calories because they're growing fast. The baby, a 9 month old baby, would need more calories than a 15-month old, and that is where we think that okay, the baby was having milk maybe almost every hour, every 1.5 hour, and we start giving the in between snacks, juice, milk between the meals, and the child does not feel the hunger, which is the interoception. And
Mm.
then what happens? Their diet decreases. They might eat a few bites and go off. And again, within half an hour, they are hungry and they again provided the milk, juice, or snack. So always remember there should be a gap of at least 2 to 3 hours between any meal, even if it is a snack.
Right, right. Yeah, yeah, I hear it on a daily basis, parents saying, मेरा बच्चा तो सिर्फ दूध पीता है या जूस पीता है, खाना नहीं खाता है. बट अगर आप हर टाइम जब भी वो भूखा होगा और आप दूध और जूस दे दोगे तो where is he no more hungry now for food?
Not for food. So that there is where we need to introspect. हम लोग क्या क्या चीजें बदल सकते हैं अपने में, और हम जो बच्चे थोड़ा सा खा के उठ जाते हैं, सेट अ टाइम फॉर देम, उनके साथ बैठिए. सो खाने का टाइम यूजुअली ना जब हम बहुत छोटे बच्चों को ही लेते हैं, इट्स अराउंड हाफ एन आवर, अगर आराम से बैठ के खाएं. तो अगर वो जल्दी फटाफट पसंद नहीं आया, हाँ पेट भर गया, भागना चाह रहे हैं, जस्ट टेल देम बी ऑन द टेबल, मैं भी खा रही हूँ, अब बस बैठिए, लेट्स जस्ट सिट डाउन, आपको दिखेगा ही दिखेगा, थोड़ा सा उठा के वो खा लेंगे. और उनको बताइएगा कि ये वाला जो मील है, अभी थोड़ी देर तक आपको कुछ भी खाने को नहीं मिलेगा. They also need to understand. If they can go and just forage for food or snacks and biscuits and juice, they will not eat. And eating is directly related to speech, which is why if you see our toddlers now, almost 80 to 85% have speech delays, have misarticulation.
That's huge.
That is huge, especially post pandemic.
Yeah. But I also know of parents who will, because the child is not eating, have the phone in front, cartoon चालू कर दिया, and then उसको feed कर रहे हैं. And the child is unaware of what the child is eating.
तो क्या हो गया? दे आर फीडिंग द चाइल्ड, बच्चे ने उठाया खाना नहीं, कुछ पता चला क्या है उसमें नहीं पता चला, तो सेंसेस काम ही नहीं कर रहे हैं. So there we have to introspect, क्यों नहीं हम खिला पा रहे हैं बिना स्क्रीन के. So it is not the child's fault or the parents' fault, but yes, whatever reasons that we have actually molded ourselves to this कि screen के बिना हम खाना नहीं खा सकते, we have to take a step back. We will have to find time. And the thing is, nowadays when you talk to, I'm not even, it's not a blaming thing or anything, but yes, people always give the reason that we have to rush to the office, सुबह time नहीं मिलता है, so जल्दी जल्दी हम खिला देते हैं. So afternoons or evenings when they come back, so they are exhausted. They do not have the energy. So feeding is, it takes time.
Correct.
You will have to devote 30 to 45 minutes for feeding.
Yeah.
It is important.
And I think that even families, in some families, the TV is on, the news is on when they are eating. And this is like such a wonderful bonding time at the lunch table or dinner table that you can spend with your child. And adults are watching TV and children are watching the smartphone, make a cartoon, and all that precious time of bonding
the
is
whole
gone.
essence of it has just dissolved. The whole essence of it. So you would see children, if we have time, I would like to mention that pocketing of food. You see children just keeping the food there.
Yeah.
They would have to be given a fluid so that they swallow it. Or the parents would come and see, अंदर गया है या नहीं, निगला है या नहीं, so that they can give a second bite. Why is it so? There are two reasons. One is the child enjoys the pressure which is there. Lot of food there, giving a lot of pressure onto your cheeks. Second reason, the child doesn't know when the mouth is full. So they would keep on opening their mouth or taking their bites and keeping there because they don't even know that their mouth is full and they can swallow. And the other thing, when we talk about, that's where oral placement therapy comes into it. If I need to chew my food, I'll have to even move my tongue. But when our children are just on their feeding bottles having milk throughout the day, which is the reflex that they are still, which is not integrated, that's your suckling reflex. They are not sucking on the feeding bottle. Their tongue moves front and back, front and back, front and back. That is suckling. And that is what they're doing with food. Until and unless their tongue moves to the sides, you have the rotatory chewing movement, the child is not going to swallow. So, feeding bottle, doctors most of the time, they say no to it. But yes, due to some reason, the parents have to put the child on feeding bottle. But my thing is throw it off. By 10, 11 months, it should be off. You shouldn't be having a feeding bottle in the house for a 1-year-old or 1.5-year-old. Not needed anymore.
Thank you. Thank you so much, Gitali. That was very, very important information that you have shared with our viewers. I'm sure it's going to benefit a lot of children and parents.
So, if before ending, can I just conclude the things which I just said?
Sure.
First of all, yes, the meal time, which even Minaj just shared, you should enjoy it. Make it a family time. You should be able to devote at least 30 to 45 minutes together. It helps. Make the child sit. Even if the child is not eating, the child can just sit there and observe. Observing, getting the sensations is going to help. Then a meal plan, which we said, so that the child knows what are we going to eat in the next meal. They are aware of it. And age appropriate texture of food. Even if we stick to these 3 or 4 things to start off, we are already on this journey where we don't have to say that, okay, my child is a picky eater. And let's not, this picky eater term is also very subjective. So when we are talking about picky eating, it is severe picky eating, less than 10 foods. Average between 20 to 30 foods. Thank you so much.
And just one more clarification, you also showed us the points So instead of, finding the exact points, is that okay if they just place their whole hand on the forehead so that they are covering the
We're
point?
covering all the points.
Yeah.
Yes. So let's do it. We can do it before we feed this child so that we are calm. And we can even do it for the child when the child is asleep with the intention that today, when we are eating or
Hmm.
when we are sitting for a meal, we both are calm. We are being able to enjoy the meal.
Right.
Do try it, it helps.
Yeah. And viewers, these are important points in Brain Gym. They are called the positive points in Touch for Health. They're called the emotional stress release points. So very, very, very effective. Great. Thank you so much, Gitali, for coming to our channel once again. And
Thank you, Minas.
we'll see you again. Looking forward to learning more from you.
Thank you.